Great. Okay, Dr. Mary Rose, would you like to come forward?
Thank you very much, Sharon. So I'm Mary Rose Sweeney, and I'm currently head of the school. Previously associate dean and deputy head, so I sometimes wonder how I got any time to do research at all, but thankfully I've done a bit over the years. So I've been researching for about 20 years, maybe close to 25, since I started my own PhD, which was a nutrition PhD in Trinity College. Would you mind moving on to the next slide, Sharon?
Yeah, apologies, yeah.
During that time, it was actually a laboratory PhD and clinical intervention work. So I was basically feeding people folic acid and then testing their serum response. So it was really interesting, and it set me up nicely for a career in research. And since then, I've gone on to do loads of different mixed methods types of research. I worked in UCD for a while on the All Ireland Travellers Health Study, and that was the largest programme of research ever undertaken in an ethnic minority group. It was a fantastic endeavour and fantastic outputs, and is often referred to since. Then I did a lot of work in autism, both prevalent work and also in supporting people with autism to navigate everyday life. I was also involved in a very large study of health determinants, the determinants of health behaviours, and that was a DediPack study, and that was across Europe, and that was a lovely project to be involved in as well. And I've also continued my folic acid work, my nutrition surveillance work. So I'm just about to publish a new study looking at the reformulation efforts of the food industry, of the food chain. So they have they're supposed to be reducing the salt and the sugar and the trans fatty acids and those kind of things in our food chains. And I've just heard this morning that the levels seem to be going in the opposite direction again. So it's a bit worrying. So it's good to be keeping an eye on it. Over the last year, I've been involved in a couple of COVID-related projects. So one was actually looking at contract tracers and their experiences during the pandemic, and of course that work has been very stressful for them. I'm also working with Breach Casey, who's the PI on a project looking at how nurses in inclusion health settings, how they coped and what they did during the pandemic to safeguard their clients. And I've also been working with Breach and a number of other colleagues in the school looking at the experiences of staff, residents and family members on the front line of COVID-19 in residential care settings for older people during wave one. And so that project hopefully is close to getting over the line as a publication. So it was really interesting and sort of probably heart-wrenching work as well to be involved in. So on the last slide then, Sharon, just some of the different types of outputs that you might expect from a project and a career of this length. So I was really honoured that the President of Ireland launched the Autism Friendly University project for us a couple of years ago, because having somebody like him involved at a launch does give you a national project a lot more dissemination value nationally. There's myself and Anthony and Andrew launching the Autism prevalence report, and the little girl with the hockey stick and the helmet there was an RT interview I did on Drive Time about John Murphy's PhD work, where we were looking at the relationship between physical activity and mental well-being in teenagers, and that was a national study. That shelf life one there is just some manufacturing kind of food manufacturer journal that picked up our research findings and wrote about it. At that stage, reformulation looked like it was going in the right direction, so they wrote a nice article on it. And then there's just some academic outputs to the American Journal of Clinical Nutrition and BMC Public Health. And then there was also a nice report there on the SOPHIE study, which was quite a big evaluation we did of Special Olympics programs on the health of participants between 2013 and 2015. So a wide variety of research, all health related. I try to go under the banner of public health research and health systems research. So if anybody's interested in talking to me, I'd be delighted to have a chat with you about any supervision needs you might have. Thanks a million, everyone.